Hello, my name is Sandra Matos. I am a pediatric and fetal cardiologist from Northeast Brazil. Over these next few slides, I shall be discussing a partnership program between two states here in Brazil, which led to the creation of a Pediatric Cardiology Network. Children with heart disease present a very complex problem. In most parts of the world, their diagnosis is difficult. There are many elevated costs involved in their treatment. And in areas where we have few resources available, this problem is made worse by long waiting lists for transferals. There is often clinical deterioration of these children. Legal demands are many times involved, extra financial and human costs, and all that sometimes still with late diagnosis and poor results. Brazil faces a lot of that, particularly in its poorest regions, the north and northeast. And this particular program is being set between two states, the state of Paraíba and the state of Pernambuco. They're both in the northeast. They share many similarities, but regarding pediatric cardiology, whereas in Paraíba there had been no structured pediatric cardiology program until recently, until 2010, in Pernambuco, those programs existed for over 2 decades, particularly our group, which is based on 3 pillars: the Pediatric and Maternal Fetal Unit, Research and Study Center, and an NGO, has been in operation at a large facility called the Royal Portuguese Hospital since 1994. These 3 branches are united under what we call the C-cell or Cellular C holding. And it was through the non-governmental organization branch, the Heart Circle, that we started developing this project with Paraíba. And the network was basically designed as a program from screening to care of fetus, neonates, and children with heart disease. And our idea was that the Heart Circle would link centers within Paraíba, and through live and telemedicine collaboration, train the local groups from screening to care of children with heart disease in that state. Now, the original design came out after studying the situation there, and we noticed that the 12 largest public maternities had over 60% of the births in the state. So the idea was to join them together with one pediatric hospital to make this big network. Now, the 12 maternities were then subdivided into 3 groups of 4, and each one of them will have a level 2 maternity and 3 level 1, which I'll get back to later, and they all be linked to the Heart Circle and the pediatric hospital. The proposed time frame was a 6-year program divided into 3 stages, which would be for the network's establishment, collaborative work, and then eventually the technology transfer to the state. And as we speak now in December 2015, we are just starting its 5th year. In terms of methods, we call it at C-Cell the Legos method, which basically approaches the problem not by bringing an outside solution or global solution, but rather looking into each one of the sites and trying to assemble blocks of technology with simple actions to lead and empower the groups so that they can optimize their own solutions. So it's a bit more plastic, and it doesn't have a fixed goal before start, and rather works with the teams to make the better of each situation in particular. So there were stages for this project. First, the development of the work model, then the acquisition and installment of all equipment, choice and training of work members, care and supervision of care, and teaching and research. And obviously all these stages overlap all the time as we work. There we could show many slides of how this was set up and done in large meetings, and teaching scenarios for showing how you put a portable echo machine and an iPad and you acquire the images, and teaching for the nurses and teleconferences for these teachings and the images of neonatal and fetal echoes being done. But we really won't go too much into this methodology. It has actually been presented and published in the current December issue of the Bulletin of the World Health Organization. We have a summary of our first 3 years of work, which discusses it in more details. Now, for the network flows, basically, we had the training part of it that has both live and online sessions, courses, lectures, and meetings. And for health, we have 2 screening basic courses and trainings. Level 1 is focused on physical examination and arterial pulse oximetry. And for the babies who failed that, Level 2 screening is a bedside screening echo performed by a neonatologist under cardiologist supervision. And then we have various training levels for clinical and intensive care. For the technical training, it's mostly related to the network management, use of the various different gadgets and the database online system that we use. Care and management, the only completely live interaction is for surgery course. The surgeons travel once or twice a week to operate and interact with local teams in Paraíba. And then most other activities take place online after the initial training. Daily rounds, maternity center supervisions, echo supervisions and reports, virtual outpatient clinics, post-op care, and networks technical support. Now, as for the results, the first thing was the development of a platform. It was all developed by the group, and we now have this network website that has all the information about the group. It has open areas and restricted areas where you can only access via login and password, where we have all patient informations and reports and on-calls, all data echoes from these patients. As for numbers of patients, during these 4 years, we have trained a little over 1,000 people have been trained in the network. Over 100,000 babies have been screened at level 1, the examination with pulse oximetry. 3,552 level 2 screening with neonatal echoes, the bedside echoes, and then nearly 1,500 neonates were detected with heart disease. All the children, about over 7,000, were screened. There were over 8,000 clinical cardiology consultations and echocardiograms performed, and 480 pediatric cardiac operations were done during this period of time, these 4 years. Many of these activities are difficult to describe, like we have regular technical visits to all sites, but particularly we have some task forces, and there is one very large task force that takes place once a year, which we call the Heart Caravan, where we join over 30 professionals that cover over 2,000 kilometers and see in 2 weeks over 1,000 patients, not only cardiologists, but we have nurses, psychologists, and nutritionists, our therapists who come and play with the children and try to teach basic health concepts through music. So it's really a very, very large action that takes place. You see here the echocardiograms done in sequence of 4 rooms with patients being examined. So that's one of the big yearly task forces we have. It's like a program within the big program in itself. A lot of innovation takes place, like medical simulations with some simple techniques, symposiums and courses, and to make sure that the patients don't drop from treatment and we realize they have to travel very distant areas. We started the heart rooms and the echo taxis. The heart rooms are basically outpatient clinics set up with all the telemedicine facilities. And the echo taxis are these pieces of luggage with all the echo equipment inside, portable echo machines and monitors and Holters, electronic stethoscopes, and they just travel throughout these towns and spend 1 week in each one of the towns. So with 3 echo taxis, we've run 12 outpatient clinics, allowing the patients to be run in combination with the cardiologists. from the Heart Circle and the local pediatricians, and that has been helping people really adherence to treatment in many of these children. Another thing is the initial network design was for 12 maternity centers and a pediatric hospital. That worked for the first 2 years, but when we presented results, the network was expanded to include 21 maternity centers and also, besides pediatric cardiology services, to do trainings in all other areas of perinatology. So there has been a big expansion of the program after the second year of work. When we look at detection rates in the state of Paraíba, if you look at the 8 main lesions and comparing to the literature which has been presented, you see that before the network we had really very, very low numbers in detection rates, and that we've had significant increases in most of the congenital heart diseases. If we looked at into the numbers of what had been reported until 2010, the reported numbers of lesions were very, very small. This is the expected number between the 8 to 10 per 1,000 live births. And as the network started in the first 2 years with the 12 centers, this is the numbers that had been detected, and now with 21 centers, we basically detecting most of the new cases of heart disease in the state. So if we look at the change in Paraíba over the last 4 years, we see that we're now screening over 95% of the public health births. We are getting people to be followed up locally in their hometowns. We have had no legal demands for treatment, and we have lowered the costs, although this has been a big study has been conducted now and will soon be showing the results, the final results. We now have a continuous medical education program that goes on from various different health professionals, and above all, we have technology being used by health professionals in remote areas, the nurses doing the works, and the pediatricians, neonatologists getting their echoes done and transmitting these images, which has really been making a big difference for the lives of these children and there. Having said that, we have major limitations and major challenges ahead of us. Our surgical program is still incipient. We've done only just over 100 operations per year, and for every 3 to 4 children operated in Paraíba, one still comes to Pernambuco, either because it's a more complex case or because of the limitation of beds, which is really our main problem, our biggest challenge. We have a good surgical group. Our head surgeon, Professor Sheila Hazim, has a very experienced team, has been doing surgery, including neonatal surgery like arterial switch operations and others. But we have problems with hospital beds. We worked in one place and then the hospital beds there didn't work. We're trying to move to another one, but still being difficult. And that's really our main challenge for now. Which is to set up a full pediatric cardiac unit and to be able to complete the phase 3 of the network within the proposed time frame. Now, we proposed to do this work in 6 years. We did the first 4 years, fortunately, but very successfully, and we've achieved our goals. But I do not think that we'll be able to complete this work without support, and probably without international support. I think we really need it to be able to complete the program within the time frame that we planned. Now, this support can be financial support, it be support in terms of donation or facilitation to the acquisition of equipment. It can be partnerships for research and helping to write up grants and to have proposals, or many other times of giving and receiving, exchanging knowledge, exchanging data management, and exchanging ideas altogether. And this is the main reason for this presentation. We're looking for this. We really believe that we should support it at this point. The team has proved their worth. For 4 years we've been working without international support, and we've been doing the work. The network has had a major impact to the health of the children. It's been at short time and at a relative low cost. And above all, if this program is completed within the time that was planned, we will not only be helping Paraíba, but we'll also be validating a new public health model which potentially could be reproduced to many other parts of the world. So this is why we're turning now for international support. Couldn't finish this without saying a very special thank you to institutions or colleagues who have been helping, like Professor Mike Rigby at the Royal Brompton, Professor Miguel Coimbra at the University of Porto, Dr. David Hannan at Eastern Carolina University, Dr. Vera Aiello at the ENCOR in Sao Paulo, Professor José Luis at the Immunopathology Laboratory at our university, all the direction of the Portuguese hospital we were set, and all the team at the C-Cell, and particularly to the core group and the coordinators of this project, which are all here together. And these people have been working day in and out to make this project a reality. So I hope you have enjoyed this brief presentation, and we would really like to hear from you if you believe you could or would be willing to suggest ways that we could be collaborating and that we could be getting further support for this project. And we thank you for your time.